I'd like to welcome you all this evening to our community conversation, Ask the Expert Concussions. My name is Mike Carr. I'm the supervisor of Crawford County Sports Medicine at the Unitied Medical Center, also an athletic trainer and a physical therapist working within the sports medicine department. Each year, as if we see more and more issues involving concussions in our athletes that participate in sports within our schools. Our program services 10 high schools in the local community across all of Crawford County, as well as a few schools in Venango County. And the services that we provide within those schools include concussion management and all the care that's involved with taking an athlete from onset of a concussion all the way through a return to play in a safe, effective manner so that they are at least risk of further complications from concussions. Currently, concussions is a very hot topic within the sports world, going all the way from youth sports to the professional level. There are many concussions involved in the professional level that are resulting in litigation. The NFL currently has a huge settlement still outstanding in regards to care for some of the former players that have had issues with concussions and ongoing. Our sports medicine program really started to focus a lot on concussion management approximately 10 years ago, and those are some issues that we will discuss this evening as we go forward in our discussion with concussion and concussion management. Our focus this evening is really on the parental side of things, as well as some of the aspects of a concussion that you might see at home in son or daughter that might be having a concussion, some aspects of things that you can do for them at home, and then the care that we involve as we move forward towards a return to activity, as well as some preventative things as well. So the staff from Crawford County Sports Medicine has worked very hard on this presentation. I'm very proud of the information they pulled together, and I know they're looking forward to be able to present it as well. Just going to do a brief introduction. Bree is one of our athletic trainers. She's originally from the Cockerton area and a graduate of Lock Haven University, and did some graduate work at California University of Pennsylvania. Whitney is a Sagertown graduate. Did her undergrad at Mercyhurst. Slippery Rock, and her graduate work at Mercyhurst, I'm sorry. Courtney is a Warren High School graduate who attended Pitt Bradford, and then also did her graduate work at Mercyhurst. Carrie is a Clearfield High School graduate and went to Clarion University and Cal for graduate work. And Mandy is from Union City and did her undergraduate work at Mercyhurst and graduate work at Lock Haven. And we also have Dr. Teresa Wheeling with us tonight. She is a physiatrist with Orthopedic Associates of Meadville. And her expertise lies in the field of physiatry, deals with brain injuries all the way from concussions all the way to serious traumatic brain injuries. And as our program progresses, we are in the process of involving physician care with all of the concussions that we have come through our program. Her expertise in that has been very beneficial to us, and it's a very symbiotic relationship. So without any further ado, I believe Whitney is starting today, and we'll get started with our informative session on concussions.
All right. I have been tasked with just kind of giving a bit of an overview of what a concussion is, some very basic anatomy, and just, again, just sort of just a general overview of some of the things my colleagues are going to talk about. So the first thing we want to talk about is what exactly a concussion is, because a lot of people, a lot of parents especially, that come in with maybe their oldest or even their youngest child, and it's the first concussion they've had in the family, don't even know kind of what they're dealing with. So it is a traumatic brain injury, and that occurs from a jolt, a bump, a blow to the head. Obviously, the head is what we're talking about, and specifically the brain. It does alter the way the brain normally functions, and what this creates is physical or neurologic symptoms that are kind of outside the norm for that individual. Previously described as getting your bell rung or a ding. Sometimes we hear sportscasters talk about it like this. A lot of times our coaches. We're really trying to get away from that wording when we're describing head injuries, because it does kind of cheapen what a concussion actually is. For those of you who may watch sports, you'll hear, the sportscasters say, "Oh, he just got his bell rung." And really, when we talk about it like that, it almost is saying he doesn't have a concussion, when really, a lot of times, we are dealing with a concussion. We want to take it seriously. We don't want to say it's just one of these things, when really all of those things are a concussion that we're dealing with. Concussions do trigger a metabolic change, not a physical change. And because of this, it's not detectable on X-ray, CT scan, MRI, or any other imaging technique. We are going to talk a little bit about how it's diagnosed, with obviously not having imaging to kind of look at it and say, yep, there it is, there's the concussion. And when you take your child, when one of our athletes or a child goes to the ER after a head injury, a lot of times they will do a routine CT scan, depending on kind of what they see when the child presents to the ER. And what they're looking for when they do this imaging is a more severe injury that really needs kind of rapid response care. So they really are looking more for a skull fracture, a brain bleed, or something that they need to be taken care of right away and taking seriously at that exact moment. So this seems a little bit silly, but a really good way to think about the brain when we're talking about it is a bowl full of Jell-O. So again, it's sort of silly, but I did bring some Jell-O. It is really a good visual. So if you think about the Jell-O inside this bowl as a brain, it can move in all planes of motion. So when you shake your head, when you receive a blow to the head, anything like that, it can move. It can move front and back, side to side, diagonal. It can move all over the place. And it is obviously housed within the skull for protection, and that the skull is obviously a hard surface. It does continue to move within the skull once movement of the head and neck stops. So if this were someone's head and they received a blow or a bolt, when I stop, the Jell-O continues to move for, a short period of time, but enough to maybe have some further injury happening. Set that down for a second. And another thing we want to talk about when we talk about this bowl full of Jell-O and the brain in general is what's called a coup and a contra coup injury. So if we look at this picture, this is really just a very elementary kind of picture of the brain. Obviously kind of delineates different functions that different parts of the brain do. So when we talk about a coup and a contra coup injury, we are talking about when you sustain a blow to the head. So if I sustain a blow to the right side of my head, obviously there's going to be some initial injury to the right side of my head. But because of the force, there's potentially going to also be injury to the left side of my head. So that's what we're talking about with a coup contra coup injury. There's the initial injury to the side that is injured, and then there's the secondary injury potentially to the other side. Because again, the brain doesn't stop moving when the head stops moving, and just the force is going to obviously move your brain to one side or the other. So in looking at this picture, we may have an athlete that comes in and is maybe having some problem with behavior, problem solving, and maybe we know that they sustained a blow to the front of their head. What we often see at sports medicine is when we do our symptom inventory, we also see that these athletes are having maybe some problems with vision and balance, coordination. And you can see from this picture, again, it's very elementary, but you can see that those are controlled by different parts of the brain. So really when if you look at this and you know that your athlete sustained a blow to the front of the head, they're not necessarily just going to have problems with that area. They may have problems elsewhere. And again, this is because the brain, again, continues to move and can affect different areas. So one of the specific instances that we've seen about this is we had an athlete, a football player, who sustained a known blow to the back of his head. He knew and we knew that the blow occurred. He actually fell and injured the back of his head. He initially described seeing stars. Thankfully for the athletic trainer at the game, he wasn't unconscious or anything like that, so she was able to speak to him. And he said that he saw stars, so we can maybe see from this picture that he had some sort of vision issues, again from the initial injury to the back of his head. He did, after the play occurred, kind of pop up right away, which is a lot of times what our athletes, not just football players, are kind of taught to do, get up, continue with the play or with the game. So he popped up right away, and then he described an intense smell of burning rubber. So again, his may have had an issue with smell, which is again in this picture you can see is to the front of the brain. And then after that, he did start to become kind of belligerent and violent towards his athletic trainer. And this is a kid who really was very kind of well-mannered, liked his athletic trainer. So maybe again started having some trouble with behavior issues. So again, this kind of demonstrates the coup contra coup injury, where we know that he hit the back of his head, had some issues in that regard, but then again, when he kind of got up, he probably also sustained an injury to the front of his head through movement of the brain. All right, we're going to move on to sort of how a concussion occurs and some issues that we run into in this regard. So one of the things we want you guys to be able to take home is that the severity of the blow does not indicate the severity of the injury. We hear so often from parents, from coaches, he didn't get hit hard enough, or she didn't get hit hard enough to get a concussion. And we know this to not be the case. Some very minor blows do correlate into a concussion when we do the evaluation. Evidence suggests that unanticipated hits, which cause increased head and neck movement, actually may yield some more severe injuries. And if you think about that, that actually makes a lot of sense. And again, it goes back to the brain continuing to move within the skull. So I'm going to come back to the jello for a second. And if I had a way to put this on some sort of arm that was kind of flexible and could move a lot, if this had an arm coming off of it, and this could move a lot. If we hit the arm and the arm was flexible and movable, this is obviously going to move a lot. So if we think about the brain that way, if you have a child that gets hit and they aren't anticipating it and the neck is moving quite a bit, then that would obviously correlate to the brain continuing to move. If this bowl was on something that was a bit more unyielding, if I had it on a baseball bat or something, and I hit the baseball bat, this is probably going to move a little bit, but not nearly as much as if it was on some sort of flexible surface. So again, if we think about our athletes or our students, if they can anticipate the hit and kind of tense their neck, their head isn't going to move as much. It's kind of those unanticipated hits or falls, things that they aren't seeing coming, that actually sometimes yield more severe injuries because their head and thus the brain do move so much more after that. Another thing we want you guys to take home is that force to the body, absent of direct blow to the head, may cause a concussion, and this is through a whiplash type mechanism. And we do see this quite a bit in sports medicine. Athletes come in and they say, I don't think I hit my head, or the parents who are watching the game say, I didn't really see him hit his head. But again, we do see this in sports medicine. A football player who gets tackled, on the body and kind of whips his head because he isn't anticipating the hit. I personally had a softball player last year who was playing outfield, and the ball was coming and she went to kind of dive forward, so her glove was out to catch the ball, and when she caught, her body hit the ground first. She caught the ball and then her head kind of whipped down, and I watched the play, her head didn't hit the ground, but she came out and it was very instantaneous that I could see that something was going on. And so it is that sort of whiplash motion. Also, a lot of times we get kids that get elbowed in the jaw. It happens a lot in basketball season. When we see that a lot, again, that would be kind of an unanticipated hit. Kids don't, go up for a basket and think they're going to get hit with an elbow in the jaw. So we see some pretty severe concussions in that regard. And then not a lot of times, thankfully, but unfortunately, we do see kids that get into fist fights. And kids that unfortunately may get punched in the face or punched in the jaw. We do see some concussions from that as well. So we really want to get away from the fact that kids actually have to hit their heads specifically on the ground, or a helmet to helmet hit. Concussions can obviously occur other ways as well. And then the last thing I have is sort of why we're talking about this today and why it's so important. Obviously, we know in sports medicine that symptoms keep kids out of sports. Not only do they not feel well enough, but it's not safe for them to return to sports when they're still symptomatic and when their concussion hasn't completely resolved and they haven't gone through a concussion management protocol. So we want to make sure that we can get them in here or to their physician, get them diagnosed and kind of get them on the correct path. We don't want these symptoms to prolong any longer than they have to, because it can be pretty debilitating to kids. We have had some kids diagnosed with post-concussion syndrome, which kind of goes along with those prolonged symptoms. They can have prolonged headaches, long-term symptoms, and this is something that can happen, into adulthood. Personally, my husband has been diagnosed with post-concussion syndrome. He played high school and college football, and we didn't graduate that long ago, but the research has really improved since then, and he's had quite a few concussions that were either mismanaged, especially in his college years, and not necessarily just mismanaged, but kids are notorious for not reporting concussions, and he'll even tell you that he had quite a few that he didn't report, so we're obviously trying to avoid that as well. And then there is a lot of research going on right now about some long-term neurocognitive deficits, some Alzheimer and dementia-type syndromes that are occurring, and there is research going into that in regards to if there's a correlation between previous head injuries and then kind of long-term deficits that people are having. That's all I have. Courtney is up next.
As Whitney and Mike said, my name is Courtney, and I'll be going over some symptoms of a concussion and also a little bit about what you can do as parents of a child that has sustained a concussion. Just some general information about the signs and symptoms. They do vary from person to person, so every child that sustains a concussion is going to have different symptoms, and they also may have different symptoms with subsequent concussions, so they're not always going to be the same. They also may not be immediately apparent and can be delayed by hours or even days after an injury, and they also can last for days, weeks, or even longer than that. One of the most important things about concussions is reporting symptoms. So you as parents need to be very aware of how your child is doing, and reporting symptoms is the most crucial for diagnosis. There's 4 different categories of symptoms that they group them into. There's physical symptoms, emotional symptoms, cognitive symptoms, and sleep changes that occur with concussions. Some of the most common physical symptoms include a headache, pressure in the head, nausea or vomiting, balance problems, dizziness, fatigue, blurred vision, sensitivity to light or noise, and sometimes they just don't feel right. Some emotional symptoms include irritability, sadness. They may be more emotional, or they may be nervous or anxious. Cognitive symptoms include difficulty concentrating or remembering. They may feel slowed down, or they may just feel like they're in a fog. They can't really describe how they're feeling. Sleep changes that may occur include drowsiness, sleeping less or more than usual, and trouble falling asleep. Some signs you can observe as parents or a guardian of a child that has sustained a concussion, and you're the first one that has come upon this child that has sustained an injury. They may appear dazed or stunned. They may be confused about what's going on, so they may not remember what they did in school the day before or what they did in school an hour ago after they sustain a concussion. They may forget an instruction that you give them. They may forget their class schedule in school or what kind of assignments they need to do for homework. They may move clumsily, answer questions slowly, and sometimes with concussions you do lose consciousness, even briefly, but not every concussion contains a loss of consciousness. They also may show mood, behavior, or personality changes. And that's kind of one of the biggest things that as parents or guardians you need to be aware of is the personality change, because you are the one that's around the child the most. So me as an athletic trainer isn't going to necessarily notice the personality or mood changes because I only see them when I'm treating them or doing an evaluation on them.